Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thanks so much for joining us. I'm going to be having a conversation with Dr. Jeannine Hoang this morning. She's the owner and operator of 4 United Dermatology Associates locations throughout North Texas. And she's joining us on the program to talk about her mission to provide exceptional health care to patients of various ages, offering services in cosmetic dermatology, medical dermatology, and surgical dermatology as well. Thank you so much for joining us this morning, Dr. Hoang.
Thank you for having me.
Well, of course, I did mention that you're owner and operator of 4 United Dermatology Associates locations throughout North Texas. Give us a bit of your background. Obviously, you are immersed in dermatology. Tell us a little bit about yourself, and then let's talk about your approach to skincare.
Yeah, so I'm a board-certified dermatologist. I was born and raised in Texas. So my husband and I knew we wanted to settle in the North Texas area because both of our parents reside here, and we are very family-oriented and wanted our children to be near their grandparents. So I knew I wanted to go back to my hometown, which is Arlington, Texas, and I started my practice in a small suburb of DFW called Mansfield. I practiced general and cosmetic dermatology, and just over the years, we've gradually expanded. So now I have several offices in the Dallas-Fort Worth Metroplex, and we do everything related to skin, hair, and nails, from medical dermatology, like your regular things like acne and various rashes, a lot of skin cancer, checks and surgery. And then we offer cosmetic services like injectables, lasers, chemical peels, medical grade skincare. And then we also have a Mohs surgeon on site, and he specializes in the removal of skin cancers through a specialized technique called Mohs micrographic surgery. I started as just kind of a normal, kind of typical dermatologist. And as I've grown in my field, I've taken a special interest in a field of medicine called functional medicine. Functional medicine is an aspect of medicine that's a little bit different than conventional medicine. And this journey started really from my own personal health journey. But functional medicine doctors try to address root cause of disease rather than treat disease through medication. And I think in traditional medicine, which I'm a medical doctor, I went through, standard training. Our approach to medicine is sometimes, I think, more reactive, where we diagnose conditions. We're very good at, talking to patients, getting a history, and coming up with a diagnosis. But the solution to a lot of medical problems is just a prescription. This is your problem. Here's your prescription. This is what you need to do. And so we tend to treat medical conditions through just standard prescriptions. And sometimes there's really no cure. You just control the disease. So in functional medicine, looks at the patient and tries to assess potential root cause of disease. And you may actually prescribe medications, but simultaneously with prescribing the medications, you're also trying to elucidate, why does this person actually have this problem? And can I teach them and counsel them through different methods of how they may actually either cure the condition through more holistic or natural sources, like changing up their diet, finding out if they might have some food sensitivities or environmental exposures that are contributing to their conditions. And if you can eradicate those root causes or heal them from the inside, a lot of their conditions go away, and then they no longer rely on medication. So to me, I've started to practice a little bit of what I would call a dual approach to my patients. Oftentimes I need medication to get my patients well, but I also try to find out root causes of their conditions so that in the long term, they're not really relying on the creams or the pills that I give them. They have really healthy, beautiful skin because they are healthy and beautiful inside.
How many, well, are there certain conditions that can be diagnosed based on what you see in a person's skin condition?
There's a lot of things that the skin will show that may give signs that there are issues internally. Mm-hmm. So one of the skin signs of insulin resistance, which is a precursor to diabetes, is called acanthosis nigricans. This is where an individual may have a hyperpigmentation or darkening of the skin within the skin folds. Mm-hmm. We commonly see it around the creases of the neck and sometimes in the underarms. Occasionally it's on other parts of the body, but the most common locations would be neck folds and underarms. And acanthosis nigricans, I actually see this quite frequently in children who are not eating well or slightly overweight, sometimes obese, and their parents will bring them in because they're concerned about what they call sometimes a rash or discoloration that they observe on their kids. And this is the first sign that individual is heading towards a path of diabetes. So when I see that on patients, I have a in-depth conversation about what that means, and then we discuss lifestyle and nutritional strategies to improve it. There's really no cream that's going to take that away. Yeah. That has to be done through diet and exercise. A lot of health conditions can be have clues on the skin. So patients will tell me about, I guess sometimes it's very nonspecific, like I'm having a lot of dry skin. I, moisturize like crazy and the skin is constantly dry. They see changes in the texture of their nails or their hair, and then they're concerned, like, what's wrong? Is this just getting older? But things that I'm noticing on the outside are not quite the same. So whenever I have patients with those kinds of complaints and worries, we usually discuss, are you drinking enough water? Because water comprises about 70 to 80% of the body, and it's very important for overall hydration, including the skin. So, simple conversations like what are you eating and what are you drinking, come into play. But if those kinds of things are in check, then we may need to delve deeper into, when was the last time you had any blood work drawn? Do you know if your hormones are okay? One of the more common issues that may cause dry skin or skin irregularities would be thyroid disease or vitamin or nutrient deficiencies.
In wrapping up,
as a dermatologist, go ahead.
No, you were going to say, just forget what I said. Yeah.
As a dermatologist, we don't necessarily treat thyroid disease, but I can definitely, point those patients in the right direction so that they can have those conversations with their primary care physicians.
Would you say that you have maybe an advantage over other practitioners having expertise in the skin as well as internal medicine? Do you think that a thorough knowledge of skin conditions should be included in just general practice as far as med school?
Yeah, for sure. The skin is the largest organ in our body, and it's what is visible to us when we see our patients. So if you are highly skilled at evaluating skin and diagnosing skin conditions, it can bridge what's going on on the outside to what's going on the inside. So physicians who know the skin and know the skin signs of internal disease may have, better clues as to where to go searching whenever they're trying to treat and diagnose their patients. Whenever somebody is having an issue with the skin, you can actually take skin biopsies, and that's much easier to do than, taking a biopsy of an internal organ. So, for example, like if one of my patients may have a bad rash, and I think that rash may be correlated with something to do with gut health, I could take a biopsy of the skin, send that for analysis, and the pathologist can tell me what's going on in the skin. And occasionally that actually can diagnose internal problems. Probably the most classic example of that is a skin rash called dermatitis herpetiformis. That is a sign of celiac disease, and celiac is associated with like gluten allergy. So if I diagnose a person with dermatitis herpetiformis, I actually know that they have a gluten allergy. Those two things are correlated. Gluten allergies are also related to other autoimmune diseases that can show up in the skin, like vitiligo, and then it's also associated with low thyroid. And so patients with those conditions might also notice changes in their skin, hair, and nails from other reasons.
Doctor, where can we go online and get some more information about the United Dermatology Associates and about skincare, surgical dermatology, medical dermatology, and the like having to do with your locations throughout North Texas?
Yeah, we have a website, unitedderm.com, UNITEDDERM.com. On there, you can find all of our locations, our contact information, and the services that we offer.
I appreciate you joining us here on the program this morning, and I'm hoping that you have a great rest of the day, and we'll be speaking again at some point.
Okay, thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.